Okay, so we're back to chapter 46, and we're going to review some of the renal issues in that. I want to start off by talking about good posture syndrome. Basically, this is an immune issue. All right, immune issue. This immune issue is caused because your body is having some type of reaction where it's creating antibodies that not only affect your lungs, but also your renal system. All right, so it has antibodies that are attacking your alveoli and your renal, specifically your glomerulars. Alright, so these antibodies are attacking your lungs at the basal membrane, specifically in your lungs, and your renal glomulars. Alright, so what's happening is your body's breaking itself down. This is the manifestation or symptoms of this is going to be cough. You might have, of course, because your lungs are essentially being broken down by themselves, you might have bleeding in your lungs. You might have poor respiration rate, labored breathing, low oxygen levels, anything that's going to reduce the amount of gas exchange that you might have normally because your antibodies are breaking themselves down. Or breaking the tissues down. All right, in the renal system, you're going to have hematuria, and you're going to find this in dang near everything. But hematuria again is just blood in your urine, and it's pretty. You'll see it in quite a bit of the manifestations for renal issues. All right, so the other ones that we'll have, you might have protein in your urine, and there's not so much that we can do for this because it is an immune issue. So when we go to treat this, we're going to treat this by using corticosteroids. If you remember, corticosteroids are hormones that mimic the effect that renal hormones would normally have. So your renal system, your adrenal glands normally secrete glycocorticosteroid, which helps decrease the inflammation. Alright, so we are using corticosteroids, which mimic the adrenal gland's effects or hormones that it normally releases by decreasing our inflammation. Alright, we're also going to suppress our immune system. Alright, now of course this is going to create issues because if we're suppressing the immune system, well, then we are left open to quite a few other issues. Regular coughs can become super coughs and things of that nature. But we are trying to depress our immune system in order to stop our body from destroying itself, okay? And again, this is all an immune issue. Now, the other part of the treatment is a transplant. You could, of course, do dialysis and try and get rid of these antibodies and start trying to filter it out. And you wouldn't want to do that you wouldn't want to do the transplant until you've gotten rid of these antibodies. But you run the risk of having it again, regardless of the transplant, because it's not necessarily coming from the renal system. It's an immune response where the body is attacking itself. So that's good posture syndrome. Let's go over pressure really quickly. I've already hit on this once, and I just want to go through it again to remind myself about the different types of pressures and why it matters. Okay, so first a colloid, and you're going to see that throughout the text, colloid, but I'm going to call it a caloid. I'm going to call it a caloid. All right, and the reason I'm calling it a caloid is because now I feel like I should draw a cow. That's a horrible cow. Anyways, so this is a cow. Alright, I'm going to call it a colloid because basically all a colloid is something that cannot pass through a membrane. Alright, so here's our membrane, and here's this really large molecule stuff, and it can shape like anything, and it can't fit through because it's too big, like a cow. Alright, so colloid. Alright, too big to get through the membrane. Here's why this matters. Okay, so a colloid is something that cannot pass through a membrane. All right, if it can't pass through a membrane, then we're going to have a certain type of pressure called oncotic pressure. All right, so let's talk about oncotic pressure. Remember, osmosis is the movement of water, and everything is about trying to seek balance. So osmosis, if we were to have, a beaker with a membrane in it, and we've gone through this a million times, but a beaker with a membrane in it, and we were to have fluid. One had a bunch of, we'll call this albumin just for the sake of calling it albumin, all right? And one only had like 1 or 2. So by volume, the amount of albumin to the actual fluid in here, this might be 30% albumin, all right? Whereas this is only 10% albumin. Now, albumin, like I just said, is too big to go through any of our membranes. It's not supposed to be in the urine, so that's how you know if we have renal issues. So because our body is looking for it to be level, we want 15% and 15% on both sides. All right, I can't move the albumin through this membrane because it's too fat, like a cow. So what I'm going to do is I'm going to move the water. And when I move the water, I'm going to increase the amount of water in this side, all right, and decrease the amount of water on this side. All right, and that might make me have 15 and 15% by volume, okay? So if I can't move this substance, I'm going to start moving water. Now that pressure, let's go back a step. So the pressure that was initially exerted, saying, hey, I want water to be over here, all right, we've got too much solute, we have too much albumin on this side, there's a pressure created there. So this pressure or attractive force of water wanting to move this way, this is called oncotic pressure in the body, okay? Osmosis is the movement of water. Oncotic is the pressure, all right, the word that we have given for the amount of pressure or attractive force of the water. All right, water wants to pull this way, and when we're talking about that force, it's called oncotic pressure. In our body, albumin should be in our vascular spaces. All right, so let's take a capillary. All right, here's our capillary. Here's our capillary wall. All right, here's albumin. All right, and I'm going to draw several of these. So these are all albumin, for instance. All right, outside of this, we know this is our vascular space. This might be a capillary or a vein or whatever. All right, it's a vascular space. We need to keep water and fluid and albumin in here. All right, outside of it is our cells. Okay, maybe let's just say this is our arms. We have several layers of cells, and then the outside of our arm. Okay, I'll just give us an arm here. All right, so albumin, by the pure nature of it, cannot fit through this membrane, and that makes it a colloid. Well, because it's in our vascular space, it not only is in there and stuck in there, but it's also attracting water to stay in here. All right, because there's so much albumin in here and not that much out here, water is being attracted to this area. And again, that's that oncotic pressure. All right, because the body is looking to make it stable. When I lose albumin, all right, so when my renal system is allowing albumin to fit through its glomerular filtration, so let's say I only have like 1 albumin, then what happens is the attractive force that was once there no longer is there at the same rate, and water starts going, oh, well, I'll go this way, all right, because I'm no longer concerned about trying to dilute the amount of albumin inside my vascular space. Now I want to go outside. Well, of course, when it goes outside into our interstitial space, you get all swollen, and you have what's called edema. All right, so that is edema, and that's why it matters for a lot of the manifestations. Because in a lot of our manifestations for these syndromes, our issue is going to be that albumin can fit through our glomerular filtration, right? And that will cause edema. All right, so here's our renal system again. Here's our kidney, ureter, ureter, bladder, urethra. All right, and this is my magnifying glass. And we're going to take this idea back out here. So, just to remind you, nephrons are the functional part of the renal system, and we have this whole thing. And I'm just going to draw this one part. We have fluid going in and fluid going out, okay? So fluid going in here is going to be pushed in, all right, and it's going to be filtered by our glomerular filtration. The body's going to decide what it wants to hang on to, namely red blood cells, albumin, things like that. It's going to let creatine pass. It's small enough. All right, so it's going to let creatine pass. It's going to let urea pass. It's going to let basically what forms plasma. All right, the red blood cells and albumin should not fit through here because they're too big, and it should be sent back out for circulation in the body. All right, in a lot of these issues, we're going to have inflammation here, which is not only going to decrease the amount of glomerular filtration rate that we can pass through here, but it's also going to start creating holes. So like, let's say I have a brick and I keep throwing this brick into this wall. Well, eventually I'm going to end up with big holes here. All right, and through those big holes, we're going to leak things that we shouldn't be leaking, like albumin and red blood cells. And that's why you can figure out if you have renal issues based off of your creatine levels in your urine. All right. So, glomerular nephritis. Let's move on to that. Glomerular nephritis is basically the inflammation of your glomerular, and again, this is your glomerular. It's again part of the nephron inside your kidney. You have rapid, acute, post-strep, and chronic. So let's start off with rapid. Rapid glomerular nephritis, and a lot of the manifestations are the same for these. So rapid glomerular nephritis is you're going to have a raise in edema, all right? So because this is swollen here, so instead of it just being that thick, let's say it's swollen and all poopy right here, all right? That makes it a lot harder for things to pass through here. So it's going to decrease my glomerular filtration rate, which again should be, again, the book says 125, I've heard 100, but anyways, glomerular filtration rate is going to decrease. So maybe instead of 150, we only got 25, all right? What's going to happen to all that fluid that our renal system is supposed to be turning into urine? Well, it's going to build up in the body, and that creates that edema. All right, when we have edema or an increase in the amount of volume in our body, we have an automatic raise in blood pressure. All right, and if that doesn't make sense to you, go back to why not to remember blood pressure and heart rate anymore. I did a video on that. But when we have a raise in the amount of volume, we have a raise in the amount of blood pressure, and because of that, you're going to have a lot more interstitial edema. All right. Also, you're going to have hematuria, which again you're going to see all over the place. It's just blood passing through here. Again, you've made huge holes in here, so now all of a sudden red blood cells can get out, or the renal system itself is bleeding. So hematuria can be caused of one of two ways. You might have bleeding in the kidneys, or you might have blood that's being able to pass through. Either way, hematuria. You can have red blood cell casts. Now, red blood cell casts, if you remember, those are cylinder shapes. We know that those are coming from the kidneys and not from the lower urinary system, and the reason why is because casts only come from your upper urinary tract. All right, so red blood cell casts. And again, casts can be white blood cells, red blood cells, protein casts, fat casts. Doesn't really matter. But it's just a cylinder type shape thing. And it only comes from your upper urinary system. All right, so what causes this rapid glomerular nephritis? What causes it is it's several things actually. Systemic disease. So anything, remember, systemic is the whole body. So if we had an issue where the whole body is infected, we could potentially have this. We also can have this by certain drugs. There's drugs that affect or are toxic to our renal system. Specifically, they refer to gold and penicillin. So certain drugs can cause this issue of rapid glomerular nephritis. You're also going to have inflammatory infections, or anything that causes inflammation in the renal system is going to cause you this. And then, of course, the favorite one is idiopathic, or they don't know why. So idiopathic causes. The other thing here to mention is that when you have drugs like penicillins, it's passive immunity, and basically it helps form antibodies. All right, so antibodies are formed. Antibodies are formed that help get rid of whatever you were using penicillin for. Well, that's great and fine, except for that the antibodies actually destroy your glomerular filtration system, and it's because it's got those big particles that it's like a brick throwing at a piece of tissue paper. Eventually, the brick's going to get through the tissue paper, and it's going to create this huge hole that allows all the escape of proteins and all types of other stuff. Additionally, that edema will be caused by a loss of protein in here, namely albumin. All right. This is caused over a couple of days or weeks. And our treatment for this is going to be treating the underlying cause, because it is a illness that is caused by another illness. So we're trying to treat the underlying cause. We can correct it with corticosteroids, which I said before, decrease the inflammation in the body, and immune suppression, which is another way of treating this. So we're going to treat by treating the underlying causes and the symptoms of it. So I want to treat the edema, I want to treat the blood pressure, but I also want to suppress the inflammation. Okay, so this is your rapid glomerular nephritis, or inflammation of your glomerular. All right, that's rapid. Acute post-strep. Now the difference between this one and rapid is only that we know that it's coming from the streptococcal antibody that is made when we become immune to strep. So let's say we have strep, all right, and of course, or hopefully, we get the antibody for strep, all right, and when we have the antibody for strep, it's acting like that brick at a piece of tissue paper. That antibody gets stuck in here, it causes inflammation, and of course, inflammation is going to have a decrease in your glomerular filtration rate and allows more things to pass through, bigger things that should not be passing through. This usually happens 5 to 21 days after you have strep. That's by that time you have the antibody for it, which hurts your filtration. All right, let's give it up. The 5 to 21 days, I already said that. It also is going to have edema associated with it, hematuria, blood in your urine, pronuria, okay, loss of proteins in through the renal system. So proteins are now able to fit through here, and like I said before, that's going to make it so your oncotic pressure is no longer holding water in, which causes edema. You're also going to have a raise in blood pressure because you have edema, and when you have a raise in volume and you have a raise in pressure. The most significant thing out of your post-streptococci glomerular nephritis is that the edema is going to be your giveaway here, and it's going to start with your low pressure areas. So the areas in your body where there's not a whole lot of pressure preventing fluid from leaking through, namely your eyes, and then it will spread to the rest of your body, your lower legs, things of that nature. All right. So your treatments for our post-streptococci is to treat the symptoms themselves, and you're only going to give the antibiotics for strep if it's still active in the body. If it's not active in the body, there's no sense in giving it. Not only that, but it's one of the things that caused the issue in the first place. So it makes no sense to do that unless it's actually active in the body. Otherwise, we are treating the symptoms of this, which is going to be the edema. We're going to watch in any situation where you have edema, you need to watch your sodium intake and your water to make sure that you're not adding to the problem, okay? Because again, sodium attracts water, and the more water we have in our body, the more edema we'll have if the pressure is pushing it into that interstitial system. All right. Other than that, you're going to treat the result of your high blood pressure. Watch your fluids and your sodium. Okay. So that is your acute. It just, as a side note, I'm looking back at my notes. It's the third cause of end-stage kidney disease, which of course is not good. Third cause of end-stage kidney disease, and it usually occurs in children and young adults, okay? Now, the last thing I want to mention is that strep does not necessarily, when we think strep, we automatically think of strep in our throat, but that's not always the case. You could have it impetigo is a rash of strep, so it doesn't necessarily need to be where you have a sore throat. It could be a skin rash of strep, because streptococci is just, that's what it is. And that can happen throughout the body. So, all right, so that is your acute post-strep. And again, the difference between, or the most notable difference between your acute post-streptococci and your rapid is the fact that we had already known that they had strep before, okay? So when we have a patient with strep, we need to tell them, hey, make sure that you let me know if you're having any issues with, edema, things of that nature. We need to watch out for this, because it will happen or could happen after you have strep. Whereas the rapid could come from a variety of different sources, and it might not even be exactly known why we have it. Of course, the chronic is going to be, chronic is your, the end stage of glomerular inflammation. Alright, so this is the end stage of it. It manifests itself, the symptoms are very slow at producing themselves, and people might not even realize until they have a raise in blood pressure and an increase in edema. Alright, you're going to find in the urine, you're going to find that urea again, and then again blood in the urine. We've gone over several times. You're also going to have a raise in uremia, which is urea. Remember, urea is the byproduct or proteins that have been broken down. Urea, of course, should be excreted, but if we have an issue where this is inflamed, we might not get all that urea out, and then you have urea building up in the body. So this is uremia, is a buildup of urea in the blood, which it should not be there. Okay, and your treatment for this at this point is just going to be treating the symptoms, and it's supportive treatment. We're not trying to, there's no cure for this necessarily. We're at this point treating the symptoms caused by the end-stage chronic glomerulonephritis. So it's chronic inflammation of the glomulars. It has a raise in blood pressure, which results in edema and proteinuria, urine in the blood, and our treatment is treating the symptoms themselves and purely supportive at this point. You're going to have a lot of scar tissue by that point. So, and of course, chronic means, just by definition, means long and ongoing. So it could have been going on for quite a while and people don't realize it. Alright, so that covers rapid, post-strep, and chronic for your glomerulonephritis. Nephrotic syndrome is the other one we need to watch. And basically, nephrotic syndrome is where we have proteins escaping out of our renal system. Of course, like I said, when you have a lack of, specifically albumin, but when you have a lack of protein in your vascular spaces, you lose your oncotic pressure, which means that water starts seeping into those interstitial spaces. Because the only thing that's keeping the water inside, or the fluid inside your vascular spaces, is the amount of protein that your body is got in there. All right, your body's trying to even out the concentration, and because there's so much protein in our vascular spaces, the water wants to stay in there to try and prevent it from being too concentrated. All right, when it's not concentrated anymore, there's no reason for the water to stay, and then it just starts leaking out everywhere. So nephrotic syndrome is proteins or excessive proteins leaving the body, specifically in your urine. All right, so again, we've created big holes in our glomerular. All right, and big proteins, big red blood cells are going to start fitting through here, okay? So, when big stuff starts fitting through here, you're going to see that raise in hematuria, blood in the urine, and you're going to see proteins in the urine. What causes these huge holes? Well, diabetes is one of them. High blood pressure, ongoing high blood pressure, hyperlipidemia, which is going to cause high blood pressure. Anytime that we have a lot of fluid trying to fit through a little spot, all right, basically this is all of our lipids building up in our body, i.e. Cholesterol. All right, whenever we try and fit through it for a little spot, you're going to increase your pressure. And when we increase that pressure, we're going to start damaging these areas, because instead of it just being, a nice gentle flow, we've got white water rapids going through this glomerular filtration, which eventually is going to start destroying that. Diabetes in and of itself destroys pretty much all small vascular spaces. So your capillaries are going to start being destroyed. Specifically, well, they don't know exactly why that is, but I mean, it's pretty easy to see that the amount of sugar that's floating around in your blood is going to affect your vascular spaces in some way. So that's what that is caused from. So back to the subject. Nephrotic. So nephrotic syndrome is an increase in the protein in the blood, or I'm sorry, in the urine. And there are several treatments for this. All right, sorry about that. All right, just looking at nephrotic syndrome when there's too much pressure. And again, when you have protein leaving the body, you're going to have that edema that we just talked about. So we're going to have a lot of edema here. And the causes of this are going to be inflammation of your glomulars or glomerular nephritis, like we just went through, infections, tumors, diabetes, drugs, certain drugs that create holes. And we said diabetes, drugs, tumors, cancer. Anything essentially that's going to create this huge hole in your glomerular. All right, so be it that we have nephrotoxic drugs in there, penicillin gold, things like that, NSAIDs, or because we've had some type of infection and antibodies are slamming up against this, making huge holes. Either way, anything that makes a huge hole where bigger particles pass through your glomerular that are not supposed to normally be in there is going to cause nephrotic syndrome, all right, or increasing the amount of proteins in your body. You're going to have tons of edema, and our treatment for this is going to be find and fix the cause. So if it's going to be, hey, our cause was this drug, let's get rid of it, so then you're going to obviously eliminate that. Find and fix cause. All right, so we need to know the underlying factor. All right, we need to treat the edema. And again, when we're talking about treating edema, we're talking about watching the amount of sodium and watching the amount of water somebody's taking in. And oh, I forgot another problem that you're going to have, or another manifestation that you'll have, besides your increase in blood pressure and your edema and your proteinuria, obviously, is going to be hyperlipidemia. Hyperlipidemia, or increase in amount of fat, and hypoalbumin, which is obvious because we just said we're losing albumin, so therefore we're going to be hypoalbumin. Anyways, all right, and you're going to also have the potential for skeletal issues here too. So skeletal issues is another issue. The mortality rate associated with this is normally caused by our immune system being compromised. Because when we have this, we're going to have issues with our immune system. All right, so nephrotic syndrome, too much protein in our urine. All right, anything that causes this is going to be the cause of making huge holes in here. Diabetes, hypertension, certain drugs, illnesses, diseases, antibiotics, anything that makes a big hole here is going to cause nephrotic syndrome. And our manifestations of this are going to be your edema, your hyperlipidemia, or increase in fats, hyperlipidemia, albumin, obviously, because we're losing it, so we're going to be hypo or below in albumin. And we're going to have a compromise in our immune system, and our skeletal system may be affected as well. All right. Bottom line, find and fix the cause of the nephrotic syndrome, and identify and try and correct the actual symptoms or manifestations of it. And that is the end of that.